And we begin this morning with a clearer picture of just how quickly the Omicron variant is spreading across the U.S. Health officials reported a staggering 1 million COVID cases on Monday, shattering the previous daily record. Listen to this stat. According to Johns Hopkins, 1 in every 100 Americans have tested positive for COVID just last week. COVID cases are up 204% in the U.S., followed by hospitalizations at 35%. President Biden is expected to meet with the White House COVID response team later today to talk through how his administration will fight this latest surge before addressing the public with updates. We have Dr. Ebony Jade Hilton with us to break down the latest COVID news. But first, let's bring in NBC News Now correspondent Dasha Burns with a closer look at how New Jersey is handling its COVID surge. Dasha, good morning. So New Jersey is one of the most vaccinated states in the country, actually. But they, like many other states, are seeing a record number of daily COVID cases. It does seem, though, that we're learning more and more that one of the most important metrics may be hospitalizations more so than those daily cases. So what are hospitals they're seeing inside their ICUs?
Hey, Savannah, good morning. Yeah, hospitalizations are at a record high in New Jersey. More people hospitalized in the state at this point than at any point in the last year, the most since May of 2020. We've been speaking to some folks over at University Hospital in Newark, New Jersey, and their CEO tells us that they've seen a doubling in hospital admissions over the last 7 days. He did say, though, that this variant seems to be less deadly, but credits that largely to vaccinations and boosters. Looking at their COVID patient population right now, not a single patient in his ICU has been boosted. Only one of their ICU patients has been fully vaccinated. And looking at their overall COVID patient population, about 70% of their COVID patients are unvaccinated. And that's really what they're stressing right now, because they are concerned that this variant is going to have a strain on the hospital system. Take a listen.
Remember that how transmissible it is ends up being the most important variable, because even if it is that much less severe, if you have a virus that's affecting that many more people because it's increasing exponentially, the absolute number of people who need hospital care could end up overwhelming the hospital. About 29% of our patients today are fully vaccinated, but not boosted, patients with COVID.
Savannah, about 1 million people in New Jersey remain unvaccinated. About twice that are not yet boosted, and those are all contributing factors, according to folks we've been talking to.
Now, Dasha, COVID isn't just impacting the number of people going to the hospital, being hospitalized, ending up there, but it's also actually affecting the hospital staff itself. How is the lack of staff exacerbating the pandemic and the situation there in New Jersey?
Yeah, Savannah, right now, that is the primary strain on the hospital system there. Staff are folks from the community. They're working within the community. So what you're seeing is a 1-2 punch where more people are winding up in the hospital at the same time as there's less staff to treat them, because they themselves are getting infected or getting exposed and are often taken out of commission for at least a week. The hospital we're talking about, University Hospital, right now has 100 staff members who are out due to COVID-related issues. And I want you to take a listen to what that really means for the hospital and for people who might wind up there. Take a listen.
The crisis becomes obvious when you have hospitals being overwhelmed. And if you have a problem, or you have an injury, or you have a condition that needs care, and there isn't a bed or staff to take care of you, then the crisis becomes more obvious. The reason we have these public health measures is to, of course, prevent disease and death, but also to make sure our healthcare system is not overwhelmed. It's a critical thing that people need. Your loved ones may need, you may need. And so because we are starting to be overwhelmed, and we're certainly seeing more cases, that should be of concern to everybody to take this seriously.
Savannah, we often talk about beds as a metric for hospital capacity, but in this case, they have beds, but a bed doesn't really mean much if there's no staff to treat and support the patient, Savannah.
Absolutely. Dasha, before I let you go, any good news about our fight against COVID in the Garden State? What are we hearing from the governor there?
Well, the good news is right now, this is different than May of 2020, right? We have tools to combat this virus. We have vaccines, we have boosters, we have masks, and that is what the governor in New Jersey and across many states, the governors and health officials are pleading with people to get vaccinated and to get boosted and to take this virus seriously. The governor called this the Omicron tsunami in New Jersey. Take a listen to what he said.
Our message is simple. Take Omicron seriously, wear your masks, get your booster, don't take a cavalier attitude, and go get tested. The symptoms between a cold and Omicron may not be much, but there is a world of difference between the two.
Savannah, he also said he believes that there are more cases and are being reported because of those at-home kits and some folks that are just not getting tested. So the real message here, take this seriously and do what you can to protect yourself and those around you, Savannah.
The Omicron tsunami, what a way to put it. Dasha Burns, thank you so much. Let's now bring in Dr. Ebony Jade Hilton for more on this. Dr. Hilton is a professor of anesthesiology and critical care medicine. She's also the co-founder and medical director of Good Stock Consulting. Dr. Hilton, good morning. Thanks for being with us. So we just heard New Jersey Governor Murphy call for more booster shots to fight COVID. And the FDA has now authorized these Pfizer booster shots for kids 12 to 15. Big news for parents this morning. What do they need to know?
Right. What they need to know is that now more than ever, it's important for them to not only vaccinate, but to also boost their children. CDC data shows that 15% of kids that are ages 5 to 11 have been fully vaccinated at this point, only 15%. You know, when we're talking about the 12 to 17-year-olds, we're looking at 53%. So we know a large portion of children are still not vaccinated in this country. And when we're looking at who's being impacted by Omicron, largely, the increase that we're seeing in our cases are literally our children. In fact, in at least 9 states, we have record-breaking numbers of hospitalizations, not just cases, but hospitalizations of our children. And that includes places from Connecticut, Georgia, Illinois, some states that have high vaccination rates like Massachusetts and Maine, and yet their children are the ones that's starting to fill up these hospitals. And if you're looking at, for instance, in Texas Children's Hospital, a third of the children that are now admitted to the hospitals are literally less than 5 years old. We're getting younger and younger in this pandemic. We cannot let up our guard as far as being hypervigilant against, COVID and having preventative measures in place, which means not only masks, but the right type of mask, including N95 masks, is the message that we need to start pushing now more than ever.
And Dr. Hilton, so just quickly, directly, your message to parents would be to 12 to 15-year-olds, not only to get your kids vaccinated, but also get them boosted?
Also get them boosted. Like what you said in the report, our definition of what fully vaccinated will change with this pandemic. And I hate that we were so cemented in our vernacular, in our vocabulary, whenever we were talking about what has to happen in order to get through this pandemic. We should say we must follow the science. And what the science is showing is that we may change from saying that it's only 2 doses to be fully vaccinated to 3. It may even be more than that. And I don't want to scare people. What we have to do is realize is that COVID-19 has not slowed down. It will be another variant after Omicron. We can guarantee that. And when we're looking at places like Israel, of which we get most of our policies when we're changing things up, we're looking at the data that's coming out of Israel because they have a very tight system. And what they're doing now is literally giving a 4th dose to those persons that are 60 and older because of the protection that it allows for in this time of Omicron. So we need to start thinking about that and definitely get your children boosted.
And Dr. Hilton, as we mentioned earlier, President Biden is expected to meet with the COVID-19 response team. That's to discuss hospital resources and expanding COVID treatments. That's happening later today. What would you like to see the president discuss? And what would you like to see his administration do to help overworked hospitals? What are tangible things that would help here?
All right. Tangible things that would help here is to first go back to what we were doing before July the 4th, where we had a mask mandate in place, and not, again, just any type of mask, but an N95 mask. The rhetoric that is just used to say wear a mask. If you're wearing a cloth mask that does not offer protection, especially with a contagious variant like Omicron, other things that can happen is literally to center policies on the most vulnerable persons. We know that these tests now cost $30 within CVS, Walgreens, Walmart, Target, you name it. Most of Americans, in fact, 60% of Americans make less than $40,000 a year. They cannot afford to pay $30 for each test. And so looking at the social vulnerability index, mailing those tests to those persons who are at high risk of exposure to COVID-19, and yet not be able to afford those measures, mail them a test to their home, mail them N95 masks to their homes, and then also target those schools. 18% of all schools in the United States public health, our school system does not have a school nurse. And we know that a more majority of those schools don't have proper ventilation within the school system. And if our children are starting to fill up our hospitals, we have to target those vulnerable communities and give them the resources they need.
All right, Dr. Ebony Jade Hilton, thank you so much for joining us this morning. Now, these surging COVID cases coupled with severe weather means the never-ending travel nightmare continues for travelers across the country. That massive winter storm that hit the East Coast yesterday created even more problems for airlines and airports struggling to keep flights on track. More than 3,000 flights were canceled because of the storms, with some travelers still stuck on their way back home from the holidays. NBC News reporter Gary Grumbach joins us now from Reagan National Airport. Gary, good morning. So we know yesterday was a rough one for flyers in the D.C. area. What is the scene there like now today, this morning? How are airports across the East Coast faring this morning?
Good morning, Savannah. Yeah, yesterday was really a mess. Today is the recovery from that mess after 88% of the flights out of Reagan National here in D.C. were canceled yesterday. That's hundreds and hundreds of flights. And we're seeing here people coming in for their morning flights that were likely rescheduled to today. It's really the cleanup from that mess today. And in the best of times, this is a pain because when 6.7 inches of snow drops on D.C., it drops on the runways too. It drops on the roads around the airports too. And that's really important to remember. Today already, we're seeing more than 1,000 flights canceled nationwide, many of them here in D.C. again. So this may be keeping people in the D.C. area a lot longer than they have planned. And this is already on top of the COVID cases that are impacting pilots and airport staff here in the area. The biggest thing that officials are telling us is if you live in the D.C. area, if you're trying to get on a plane today in the D.C. area or anywhere across the country, see where your incoming flight is coming from. And if that flight is taken off from that destination, coming to this destination, you can see that it will arrive, and then that's a lot more likely that you're able to get on your next flight if that flight incoming is going to actually arrive at your destination.
And that's a really good tip there, Gary. Also, you mentioned the actual staffing shortages that's happening at hospitals. Just with TSA alone, 2,600 TSA employees are currently out sick with COVID infections. How much of an impact is that having on flights across the country and travelers' experiences at airports?
Yeah, look at those numbers on the screen there, Savannah. 2,600 people January 3rd were out, more than 1,000 more than were just a few days before that. And that's really important because snow, it impacts a region, an airport, one part of the country. TSA agents, they're at every airport all across the country. And if they start getting sick, there's no reserved TSA agent crew that can come in and replace them. Plus, these TSA agents, for the most part, are local to these airports, unlike flight pilots or flight attendants are where they're from across the country. So I think that's a really important thing to remember. As TSA agents start going out sick, the lines you're seeing at airports may get a lot longer.
All right, Gary Grumbach, thank you so much. So will the weather today hold out while those crews try to get travel back to normal? Let's get a check on your Morning News Now weather and see. Hi, Bill Cairns. Good morning.
Hey, good morning to you, Savannah. And, the story that's unfolding is on I-95 south of D.C. There's still a 40-mile stretch of I-95, major interstate, that is closed. And there are hundreds of cars that are stuck on I-95. And Josh Letterman, our NBC correspondent, he's one of them. He's been in his car for now 11 hours with his dog as they're just trapped, waiting for the roads to get cleared. And it's mostly because of jackknifed tractor trailers. And you can just see, the roads iced over, and it is frigid on the heels of our major snowstorm in Virginia. I guess they're just not prepared to be able to clear that amount of ice and snow. So let's get into the forecast and what happened. Right now, where those cars are trapped and where it snowed yesterday, it is 14 degrees in Fredericksburg. So you get the idea. It snowed. It was a heavy, wet snow. And then last night, the temperatures just plummeted. And so whatever slush was out there, it is just iced over. So it's just a travel nightmare in this region. The winter storm is long gone. There are clear skies in its wake. You can see the storm as it moved on out. The snowfall totals, these are the highest amounts per state. So in Maryland, Huntington Town had over 15 inches. Glendive, Virginia, 14 inches. 14 was a common number there in Delaware. Also Ocean City, New Jersey, and even the mountains of North Carolina had almost a foot of snow. As far as the major cities went, Fredericksburg was the highest. Atlantic City, New Jersey, over a foot. D.C. at Reagan had just about 7 inches. Richmond, Virginia, and Philadelphia, that was the northern and southern extent of the snow, where lesser amounts fell. So what's next? We are going to see another storm developing as we go into the next couple of days. It'll move from the plains to the mid-Atlantic by the time we get to Thursday night, and possibly even a nor'easter type storm come Friday morning. So we could have another significant snow event to talk about. Not for today. This will begin tomorrow and then towards the end of the week. And just so you know, this is our American GFS forecast model. This gives us I can look 5 days out in advance for the snow. Anywhere in the pink is up to 8 inches. So today and the next couple days through the northern Rockies gets hit pretty good. Not much in the plains, but then the storm gets a little bit stronger, possibly once again, Tennessee, Kentucky, and maybe even the same areas that was just hit yesterday. So for today, eventually, Savannah, we will melt some of the snow around D.C., especially on the roads with the temperature near 40 degrees and a good deal of sunshine. But it's a mess. We still have 280,000 people in Virginia without power.
Wow. And poor Josh Letterman, my goodness, 11 hours in the car.
Yeah.
Ay, ay, ay. All right, Bill Cairns, thanks so much. See you next hour. Now to that highly anticipated verdict in the trial of Elizabeth Holmes. The Theranos founder was found guilty on 4 federal fraud charges for exaggerating her company's blood testing technology to investors. Now, Holmes faced 11 charges in total, but was acquitted on any that involved defrauding her patients. There's the big difference. She now faces up to 20 years in prison for each guilty count. Joining me now to break this all down is NBC News senior business reporter Ben Popkin, who's been covering the trial. And we also have NBC News legal analyst Danny Ceballos. Good morning to both of you. And Ben, I will begin with you. So walk us through this verdict. There are a lot of charges, several different outcomes. What counts was Elizabeth Holmes convicted on, and where did the jury remain deadlocked?
Well, on the first count, conspiracy to defraud Theranos investors, the jury found Elizabeth Holmes guilty. On the second charge of conspiracy, not guilty. On counts 3 through 8, these were wire fraud charges connected to defrauding individual Theranos investors and firms. And this is where we saw a split. On counts 3 to 5, there was no verdict, the judge declaring a mistrial on these charges, which were for the smaller amounts of wire fraud in the indictment. But in counts 6 through 8, guilty for a total of over $140 million in fraud, $100 million from the DeVos family office alone. Counts 9 through 12, defrauding, conspiracy to defraud patients, not guilty. And earlier in the trial, the 9th charge was dropped.
Danny, let's bring you in here and focus in on those charges related to defrauding her investors, the one she was found guilty of. As we said, Elizabeth Holmes was convicted on 4 of those counts, but the jury remained undecided on the other 3. What was the distinction in those charges, and what do you make of that?
Well, the key is that each of those were discrete charges involving different investors. And so they rose and fall on the credibility of the government's evidence as to each charge. But the way to read this is really a victory for both sides. For the defense, whoever thought Elizabeth Holmes would get an acquittal or a deadlock on any of these counts, especially after she took the stand and appeared to perjure herself right there in front of the government, who confronted her with all of her prior inconsistent statements. For the government, this is a victory. They're not feeling that way today, but that's because U.S. attorneys are the kind of people who complain if they get an A instead of an A+. They're despondent. But this is a win for them. She will spend, and I've done a rough sentencing guideline calculation, at least on the order of 10 to 15 years in prison, and possibly a lot more than that. And the judge will consider even the acquitted charges as what's called relevant conduct when the judge is calculating the sentence. So this is a win for the government. They would have wanted convictions across the board, but a victory for them nonetheless.
Danny, let's talk more about calculating the sentence. Elizabeth Holmes faces up to 20 years behind bars on each of those 4 convictions. Is it likely she'll get that maximum sentence?
Normally, I say no way. When we talk about the statutory maximum, in this case, it's 20 plus 20 plus 20 plus 5, 65 years. Normally, that is a fictional number, and the real number is somewhere closer to the sentencing guidelines. But the strange thing about this case, or I should say a common problem in white-collar cases, is that when you have an amount of loss, the loss amount is in the 140 million, then the guidelines send the sentence into the stratosphere. And Elizabeth Holmes may be looking at not 65 years, but possibly more than 20, possibly more than 25. And again, it is that loss amount that just jacks up the guidelines, almost quadruples her level score away from her original fraud guideline.
And Danny, quickly, you mentioned how the state would be feeling about this. I mean, let's talk a little bit more about it. I just want to kind of hear your opinion on how each side did. I mean, this was all so highly publicized before the trial even began, with many people having these strong opinions formed about Elizabeth Holmes before it started. Ultimately ends with this rare case of so many different outcomes on multiple charges. What's just your evaluation of how both the prosecution and defense did here?
A lot of folks may take a look at this verdict and say, this is about favoring investors and convicting her for what she did to investors and ignoring patients. But I think that would be missing the point. After all, it seems that the case against involving the investors was probably an easier one for the government to make. It may be the case that the jury concluded that Elizabeth Holmes' intent was always to defraud only investors and not patients at all. So it doesn't mean that the jury devalued these patients in arriving at their conclusion. And also keep in mind, this is from a jaded defense attorney, that the government may have included those patients as victims to humanize the victims. After all, the other victims were millionaire, billionaire investors, and maybe the jury wouldn't have related to them. So the government brought them in for a strategic reason, these patients, didn't get a conviction on them, but probably helped serve to humanize.
Danny, your jadedness means that we get to hear it straight, which we always appreciate. Ben, let me bring you back in here quickly. What's next for Elizabeth Holmes? Do we know anything at this point about her sentencing date?
Well, she remains at liberty on bond. The government's asking that be changed to a secure bond, meaning the Holmes would have to either put up cash or property. There's a hearing next week where we'll likely hear when her sentencing date will be, which typically would be maybe 1 to 2 months from now. And it's likely she'll appeal. It seems the epic saga of Elizabeth Holmes' fall from grace is far from over.
Ben Popkin, Danny Ceballos, great analysis and reporting there. Thank you both so much. Now, new court documents show New York's Attorney General has subpoenaed former President Trump's children, Ivanka and Don Jr. It's all part of a civil investigation into the Trump Organization's business practices. NBC News correspondent for investigations Tom Winter has been following this case and joins me now. Tom, good morning. So what does New York Attorney General Letitia James hope to learn specifically from Trump's children?
Right. So I think they're focused here on a couple of different things, Savannah, but the main one is the idea of the valuation of the properties involving the Trumps. So what did they tell people their properties were worth? In one particular instance, Seven Springs, which is a property in Westchester County, New York, so it's in New York State, obviously gives the AG jurisdiction to look into it. There was a $20 million plus kind of tax write-off that they had in 2015 based on how they valued that property and some decisions that they made with it. I say that is just one example of an area that she's looking into. This is parallel, of course, with a criminal investigation being led by the Manhattan District Attorney's Office, along with the Attorney General, that's looking into a lot of the same types of things. So that's what they're hoping to look into. They said they also, the scope of this questioning, and they are seeking to speak to not only the former president, but as you said, Ivanka and Donald Jr. They're looking for documents, and their testimony could involve any other areas that they deem pertinent. So obviously, that's a pretty wide berth there as far as things that they're looking to talk to them about, Savannah.
Now, Tom, the former president and his children fired back with a motion arguing against these subpoenas. What are they saying?
Right. They called it, quote, unprecedented and unconstitutional. They said that, look, they're engaged in a criminal investigation. They can't issue subpoenas, they argue, for testimony under the guise of a civil investigation that'll immediately become available to the investigators. So in other words, they take this deposition for the civil investigation, right, Savannah? And then they could turn around and say, hey, they said this in our civil deposition. You guys might want to have this on the criminal side. That is possible. It's also possible that they could ask about things that they might assert their Fifth Amendment privilege to In the civil realm, that's helpful because you can say, well, they claim Fifth Amendment privilege on all of these different types of things, could also provide a bit of a roadmap for investigators. So it's understandable why they would attack these subpoenas on those grounds, Savannah.
And hey, Tom, quickly, New York's been investigating the Trump organization for a while. So now that we have family members being subpoenaed, what could that mean for the timeline here of this investigation?
Right. So I think it's obvious that they're going for the principles of the Trump organization, which is obviously the former president and his children. Right. And so when you're seeking to speak to those people, that's a good sign that this investigation is close to wrapping up. And in fact, that's what we've been told. I think this is the marker that they're close to the end. It's not definitely the end, but whenever you want to speak to kind of the principles or targets or subjects of your investigation, whatever phrase might be appropriate, I think subjects here, then you're probably close to the end. And that's where we are, Savannah.
All right, Tom Winter, as always, we appreciate it. Thanks so much.
Sure thing.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.